Welcome, everyone. My name is Ingrid VanderElst. I'm a partner in the Toronto office of Fasken Martineau. We're here today to talk about the use of artificial intelligence in healthcare. I think it's no secret that AI is part of a digital revolution that's been transforming most industries, including healthcare. The potential for AI to improve healthcare is massive. AI-driven diagnostics can help with earlier detection of diseases. AI may also be used to monitor patients remotely in real time via wearable devices with alerts sent if certain thresholds are reached. AI-powered chatbots can assist HCPs, healthcare professionals, with triaging patients, and it can also be used to design treatment plans and to predict treatment outcomes. And of course, AI at its most basic level can be used to improve basic healthcare operations like HCP note-taking and resource scheduling. In a world where there's increasing pressure on healthcare systems, technology that can enhance efficiency and reduce costs should be welcomed and exploited to improve health outcomes globally. However, according to a 2025 white paper issued by the World Economic Forum on the future of AI-enabled health, compared to other industries, healthcare's digital maturity lags behind the global average. As such, the sector has yet to really make full use of digital technologies to create significant value. Although AI is being deployed in the healthcare industry, the World Economic Forum's conclusion is that obstacles are preventing it from being adopted at scale and realizing its transformative potential. Today, we're going to try to unpack that a bit and discuss some of the obstacles that are in place to a full-scale embracing of AI in the healthcare industry in Canada. We've gathered experts from regulatory, privacy, intellectual property, and commercial law areas to provide their perspectives on what the issues might be and how we might think about resolving them. I'm now going to ask each of our Fasken experts to introduce themselves briefly, and then we will open up the discussion. I'll start it off with you, Manpreet.
Thank you, Ingrid. Hi, everyone, and thank you for joining us. My name is Manpreet Singh. I'm a partner here at the Fasken Toronto office. I work in the life sciences group, and a lot of my practice in the AI space revolves around working with clients who are either deploying or developing AI for use in the health sector. So I'm excited to share some of my perspectives with you. Heather?
Hi, everyone. My name is Heather Whiteside. I'm an associate in our Toronto office, and my practice focuses on both privacy and health law matters. I work with clients in the private and public sectors, helping them understand their obligations to comply with privacy laws, and work particularly with clients in the healthcare space when health information is involved.
Again, hello, everyone. I'm Gabriel. I'm a partner also in the Toronto office. I practice in the technology law group, so I'm coming here to bring the commercial perspective. We do a lot of work for customers. We do a lot of work for vendors as well. So we see these issues, the emerging AI issues from both sides of the fence. We do a lot of work, again, for who's buying technology. A lot of it, large technology purchases are, hospitals, healthcare institutions, and a lot of the vendors we work for are folks who are playing in the health product space. So looking forward to sharing my insights with all of you.
Hi, everyone, and thank you for joining us. So my name is Julien Verneau. I'm a partner, I'm a lawyer, and a patent agent in our Montreal office. I'm in the IP group, and I work a lot with life science and healthcare companies. So I've been practicing for a little bit over a decade now, and I do two things with my life science clients. First, I help them put together patent strategies and obtain patent rights, in Canada and throughout the world. But I also litigate for them. So I help them enforce or defend enforcement of patents before various courts in Canada. So nice to meet you all.
Right. Thanks everyone for your brief introduction. I think a logical place to start is maybe with Manpreet. As a life sciences lawyer, Manpreet, and given what you've described in terms of your practice scope, what are some of the most common pitfalls that you've been seeing organizations tackle as they are developing or trying to employ AI within the healthcare environment?
Thanks, Ingrid. So there are several, and they apply both to vendors as well as to healthcare organizations, albeit from different angles. And you'll notice from the diversity of our panel today, too, that AI doesn't neatly fit in one bucket, right? There's no overarching AI framework in Canada. It's still a work in progress. We're still waiting for those unifying laws. And so because of that, we end up operating in a bit of a gray zone where you're considering commercial issues, patent issues, regulatory issues, and privacy issues all at once. And it can be difficult to navigate, each of those and understand that there are various obligations that come with each of those sets of laws. One of the things that I like to start with is the technology itself. So we do in Canada have an established framework for medical devices. So a lot of what's going to apply to AI are going to be the existing laws we already have. In the technology space, one of the most relevant ones is the medical devices regulations. So this framework basically establishes that if you're using a tool and that tool is going to be used, regardless of whether it's a piece of hardware, software, an instrument or anything, if it's being used to treat, to mitigate, to diagnose, or to prevent a disease or abnormal physical condition, it's probably going to fall within the definition of a medical device. And because a medical device is a regulated class of product, you do need to get approval from Health Canada before you enter the market. And so one of the pitfalls, I guess, is that there can be a misalignment between what the vendor views their product as and what perhaps a healthcare organization or a customer will view that product as. So, for example, vendors might sometimes, in order to avoid that classification and the regulatory burden that comes with it, position their product as something that's more of a supportive tool that supports a clinician's practice rather than something that's more deeply integrated into it and therefore could push into the medical device territory. Healthcare organizations, for their part, might just assume something has regulatory approval when it doesn't, or they may not have a clear understanding of what's going to need medical device approval and what is just going to be used as a general consumer tool. So it's really important to get on the right side of that right at the get-go, because it can really slow down the proceedings if you're at the procurement stage, you're about to either sell or buy a device and it turns out that it needs to have regulatory approval. So on the vendor side, really understand how your tool is going to be used within the clinical setting. It's one thing to market and to advertise your product in a certain way, but you also do need to give mind to how it's actually being used, because both of those things could be factors into how you're going to be classified and what regulatory hurdles you need to meet. The other thing I would add is that you, as a vendor, you would also need to understand how clinicians are going to have to, meet their own obligations. So there are privacy laws that Heather's going to talk about in more detail. There are regulatory laws, and it's best to design those and integrate those into your device right from the start, than have to go back and fix things and backtrack. So think of it as regulatory and privacy by design being implemented right in the beginning of the life cycle. And because the use of AI in healthcare particularly does have higher risks than in most other applications, because it can in fact impact somebody's life. It could be a life or death situation. There's a heightened concern around accuracy and reliability and bias. So you want to make sure that you can provide documentation, if you're the vendor, that your product is, how it arrives at its output. So explainability, make sure it's not behind a black box. Healthcare organizations should be doing the same. They should be demanding this kind of information so that they can make a full and informed decision on which AI solutions to use. Another consideration from an ethical standpoint is that we need to make sure that those tools are actually performing consistently across diverse patient groups. So algorithms need to be tested. There needs to be some sort of post-market monitoring plan. Physicians should be giving feedback to their AI solutions providers to address issues that arise in real time. So really, you need to be mindful that the AI, because it's not we know it's not stagnant. AI evolves. It could improve in accuracy and reliability, but it could also go the opposite way, where we have model drift, which is where accuracy and reliability go down, either because the data no longer becomes representative or because it's lower quality data. So it's important to be mindful that this is not just another IT solution. It does have unique risks associated with it.
Thank you, Manpreet. It's struck me that, what you've raised a few pitfalls, but, one of the main pitfalls is, how is the AI tool classified? Is it a medical device or is it something else? And I think what's jumping to my mind is, things like a smartwatch or something that's giving you a lot of information about your oxygen levels, your heart rate, your blood pressure. Is there like a sort of a good black and white rule as to when something crosses the line into being a medical device versus just sort of a consumer tool, or is it nebulous? What's the situation?
And that's a really good question. Thank you, Ingrid. So I think what I should make clear at the beginning is that just because a device is used in a health setting or has something to do with the human body or measuring any sort of parameters doesn't automatically make it a medical device. Same thing if it receives health information. It doesn't automatically mean that it's now a medical device. So we can think of it as a spectrum. On the one hand, we have tools that are clearly not medical devices. So these are like wellness apps, or I have one too, your speedometers, your Fitbits, your Apple Watches, which basically help you monitor your own wellness. They don't really feed into clinical decisions about your health. They don't really help diagnose you with anything. They just kind of give you information. There's a lot of those products because there is a bit of a wellness trend these days. And so you see a lot of them, and they're not going to be medical devices just because they do something associated with the human body. In the middle and the more borderline tools are the ones used in hospitals and hospital settings, where you're looking at images and maybe identifying abnormalities, right? Because in that instance, you could be influencing how a physician is going to treat that information, as opposed to scheduling appointments, as opposed to something that just transcribes a patient-physician interaction. Those tend not to be as high risk as something that could look at an image and maybe identify abnormalities. At the very other end of the spectrum are things that are very clearly going to be medical devices. These are things that are actively used in treatment. They're used to decide next steps and next, drugs or medications, treatment plans. Another really big consideration is when the medical device is used or the tool is used. If you're using it as part of a monitoring for a long-term, slowly progressing chronic disease, maybe you're a lower risk medical device, or maybe you're not a medical device, depending on the functionality. But if you're a tool, an AI tool that's used, in critical life-threatening situations, you're likely to be a higher risk medical device. So really, vendors need to think carefully, because the more a tool moves from just supporting a clinician to actively driving clinical decisions, the more likely it is to become a medical device. And so both healthcare organizations and vendors should be asking the same question, and that's whether or not this device needs to be licensed before it can be used in a setting with patients.
Thanks very much, Manpreet. As you're describing the different kinds of potentially medical devices, it certainly becomes apparent that these tools are collecting a huge amount of information, some of which is sensitive medical information. And so, obviously what jumps to mind is that there are very significant privacy considerations that have to be taken into account when developing, implementing, employing this kind of technology. I'm wondering, Heather, if you can comment on sort of how this is dealt with, how this technology is dealt with from a privacy law perspective. We obviously have laws of general application in Canada at the federal and provincial level. Can you comment on how those laws interact or apply to this sort of technology?
Mm-hmm. Sure. And I think that's exactly right. And I would just emphasize what Manpreet said, which is that in Canada, there's no existing general AI law. And so when we're talking about the legal framework that governs the development and the use of AI technologies in the health sector, we're really thinking about what existing laws there are and figuring out how they map onto or apply to the particular technology or use case. And one area, of course, where there's lots of intersection is privacy law. And privacy laws, which govern how organizations use personal information, are relevant primarily in the context of the development and use of generative AI tools. And by that, I mean, a subset of machine learning that relies on large data sets to train models and fine-tune models. And so personal information may be involved in that training data, and personal information may also be involved in content that is generated through a generative AI tool. And so this, of course, has implications for individual privacy and implicates privacy laws. And we've seen, in guidance recently from federal privacy commissioners that are thinking about how healthcare organizations use particular tools like AI scribes. What's very clear in all of that guidance is that developing or using generative AI has to comply with existing privacy laws. And so the question is, well, what are those existing laws and how do they apply? As you said, Ingrid, Canada has a patchwork of federal and provincial privacy laws. Some apply in the public sector, some apply in the private sector, and some apply in most provinces have provincial health-specific privacy laws. And so the inevitable question that a privacy lawyer usually starts with is, well, what privacy law applies? And that can be a tricky or challenging or fun question to answer. For example, if you take, a hospital in Ontario that has procured an AI scribe, that hospital is subject to Ontario's health privacy law when it's handling patient information, including when that patient information is recorded or transcribed through that technology. The vendor that provides that tool would also be subject in certain ways to sort of flow through obligations from Ontario's health privacy law when they're handling information for the purposes of providing that tool to the hospital. That vendor, though, may also be handling data sets across the country or in other provinces and other jurisdictions, may also be using data for training its models, and so may also be subject to the private sector federal privacy law in some aspects. So figuring out which law applies and then which, it sounds complicated, but the good news is that Canadian privacy laws are generally principles-based, and so they're not actually overly prescriptive about how organizations are implementing the requirements or those principles. And those principles tend to be, as I said, consistent across various regimes. So they focus on things like transparency and accountability and openness. They focus on the legal authority to collect information, typically consent. They focus on data minimization. Are you collecting the minimum amount of information that you need for your purpose? And safeguards as well. So how are you protecting information? And are those safeguards appropriate to the sensitivity of the information you're collecting? And so these principles can all be applied, some more easily than others, to AI tools that are processing health information. So think of transparency, for example. Do patient users know that they're interacting with and providing their intake information? Do they think they're providing that to a human, or do they know that they're providing that to an AI assistant? In applying the principle of data minimization, are you collecting, this one is trickier because are you collecting just the minimum amount of information that you need to provide the healthcare service, or are you hoping to collect more information because greater amounts of information may be helpful for training certain tools? As I said, these are the sorts of principles and questions that have to be applied, that exist currently, but have to be applied to new technology applications.
Yeah, it sounds complicated. Heather, I know you mentioned that the principles in the various privacy laws are quite consistent, but it's the application to specific types of information, I think, where it gets to be a bit more difficult. You've touched on, that there's a health sector privacy legislation in a number of provinces, and you've also, I think, touched on some of the ways in which that may impose a little bit of a different standard on the information collected as part of AI health tools. Is there anything more that our audience should be aware of in terms of these health sector specific privacy laws and how they shape what's permitted?
Mm-hmm. Yeah, I think there are some considerations that are specific to, or maybe just more significant when health information is involved or when health privacy laws apply. And I would distinguish between those two because sometimes we're talking about health information, but it doesn't necessarily mean that the health privacy law applies. So for example, a direct-to-consumer fertility tracking app might be using AI for predictive analysis or have an AI assistant that answers users' questions about cycle tracking and things like this. And that information and the provider of that app may not necessarily be subject to the health privacy law if there are no, for various reasons, but those general private sector privacy laws would still recognize that there's something inherently sensitive about that type of information. And so certain obligations might apply differently depending on, given that heightened sensitivity. But in either case, whether we're just talking about health information that's subject to general consumer privacy laws, or we're talking about health information that's subject to health privacy laws, I think there are two considerations that I'd say maybe deserve more attention. The first is consent. And as many of you probably know, consent in Canada can typically be express or in certain circumstances implied. But recent Privacy Commissioner guidance, particularly in BC and Ontario in the health sector, has indicated that in the majority of clinical scenarios as a best practice, healthcare providers really should be obtaining express consent from patients before they're using generative AI technology to process health information. And they'd suggest that implied consent, which may be appropriate for other use cases, would not be appropriate given the novelty and the complexity of generative AI technologies. So from a provider perspective, I think that means you're thinking about how patient notice and consent is incorporated into existing processes. And then from the developer perspective, thinking about, okay, does your tool have the functionality and the workflows to facilitate consent when it needs to be obtained expressly? And the second consideration I think that pops up in the health sector quite often is considerations about de-identification. As a general rule, health privacy laws will apply to information when it's in identifiable form. And once that information has been de-identified or anonymized, it generally falls outside the scope of the applicable privacy law, except for certain continuing prohibitions on things like trying to re-identify that information. And this presents opportunities to use larger data sets, possibly without consent and still in a privacy respectful manner. But the challenge is that there are differing standards and definitions for what these terms mean across jurisdictions and across privacy laws. And that I've seen play out in challenging ways in commercial negotiations, for example, where a vendor will say to a healthcare provider, we intend to retain some of your information in de-identified form to use for product improvement and training our model. And what the vendor thinks when they say de-identified is different than what the customer thinks when they say de-identified. And it turns out they have different ideas about, whether an IP address or certain metadata that's included would fall into the category of what the contract calls de-identified. So that's a crucial element, I think, to consider for healthcare providers as part of their diligence when they're thinking about procuring new AI tools, and also useful for providers to think about proactively to do a PIA, to have information and materials available to explain exactly what your processes are for de-identifying the data in a way that would meet sort of the highest requirements in the jurisdictions in which you're operating.
That's helpful. I can imagine, especially if you're dealing with developers of technology that are not Canadian based, they could be from Europe, they could be from the US or anywhere really. I'm guessing that different jurisdictions have different definitions of what de-identified is and what anonymized is. And so a vendor may have a particular understanding of what information they're allowed to collect and use, and that might not dovetail nicely with what the Canadian view is on that. So it sounds like it would be challenging and a bit of an education exercise sometimes, right? When you're trying to negotiate between two parties to make sure they're all on the same page.
Mm-hmm, exactly.
So that segues nicely into the next item I wanted to address to you, Heather, which is, as we're dealing with vendors who are multinational, they're not based in Canada, perhaps, or maybe they are, but nonetheless, data collected has to from these AI healthcare tools, the data has to cross provincial borders, maybe international borders. What are the challenges for organizations when they're trying to develop or deploy these solutions sort of across borders? What do they have to keep in mind?
Mm-hmm. I think the obvious one, sort of just summarizing what I've said previously, is that knowing that an AI product can sit sort of in different legal environments depending on the customer, depending on the province, and that can be the hardest sort of practical issue. And it becomes a matter of sort of building to the strictest common denominator. The other element to think about is, I think, as you said, cross-border data flows. That can add another element of complexity. That said, there's no sort of general absolute prohibitions on transferring health information outside of the province in which it's collected, so long as organizations have appropriate safeguards in place to ensure that data is appropriately protected when it's outside the province or the country. And one way I think that lawmakers are trying to address this kind of fragmented, siloed nature of health laws and the inability to transfer information between systems and provinces and jurisdictions is by focusing on efforts to improve interoperability, which is the ability to for systems and applications and organizations to connect and to communicate and to exchange data in a more seamless manner. And so at the federal level, Bill S5, the Connected Care for Canadians Act, has been introduced, and that would apply to health IT vendors and impose a few requirements on them to support interoperability and prohibit data blocking, for example, which is, I think, intended to address this concern about healthcare providers facing, long waits or getting unreadable data when they're trying to switch software providers. So there's definitely, it's not specific to AI, I'll say, but there's definitely something to think about there as organizations are trying to anticipate how they can build a product or scale across Canada in a way that will comply with sort of any future requirements around interoperability.
Thanks very much, Heather. I think I would like to just tie off or finish off the regulatory discussion by taking it back to Manpreet for a few more comments. So we have an AI tool which we think is a medical device. Assume we've got all the privacy angles covered based on the guidance Heather has given. Manpreet, what would you say about how Health Canada is approaching AI-enabled medical devices? Do they have a coherent approach, or is it challenging given their current thinking? Is it challenging for an organization that wants to enter the market in Canada?
Thanks, Ingrid. So Essentially, Health Canada has done its best to try and keep up. The problem is that the food and drugs regulations, under which the medical devices regulations sit, they're not really they're not really technology focused. So they're not really specifically designed to handle sort of the unique risk categories that AI raises. So that's the potential for bias, errors, and hallucinations, the privacy and cybersecurity vulnerabilities that could arise, as well as performance degradations over time. So really, AI does present a new bucket of risks that the current regulations aren't necessarily equipped to handle. What Health Canada has done in response is release a series of guidance documents. So guidance documents aren't laws, but they are interpretive documents that help you understand what Health Canada's expectations are going to be. There's a couple of these that are specific to AI. So includes AI. So there's one on cybersecurity. There's also one on machine learning. Overall, our experience has been, unfortunately, that getting regulatory approval for an AI-enabled medical device, the threshold is a little bit higher, which means the timeline to market can be a little bit longer. So really, you need to think strategically right at the beginning. And the best way to shorten that time to market is to make sure you understand what Health Canada's expectations are going to be and that you're prepared to be able to respond to any additional questions that you're going to get from them. Keep in mind, this is still fairly new for Health Canada and for its reviewers. And so you can expect that there may be a more protracted approval application process than you're used to with traditional medical devices. There's a couple areas that I would flag for anyone who's in the development space. When it comes to preparing this application, you want to provide right at the outset as much comprehensive information as you can about the way the AI or machine learning enabled device functions. So MLMD, for example, how does it function? How does it derive its output? How does it work? What's it for? Providing that information, right at the outset can really help streamline your application. The other thing is that, another concern of Health Canada is how is the developer managing risk, given that there can be performance degradation over time, given that, the AI tool learns, it uses new data, it can change, it can adapt. How are you controlling that? Because what they're used to is a medical device that is fixed in time. This is a very different horse that they're dealing with. So to be able to address that, what they have introduced is this concept of a predetermined change control plan. So it's basically a pre-authorized plan for post-market changes. And if you have a medical device that is approved with a PCCP, as the acronym goes, with this plan in place, what it allows you to do is make sort of these predetermined or predisclosed changes throughout the life cycle of your product without having to apply to Health Canada for a license amendment each time you make those changes. Traditionally, when you have a medical device and you make a change, depending on whether the change is significant or not, either way, you generally have to provide Health Canada with an update. This can be in the form of a very quick sort of fax back application, or it can be a much more robust, significant amendment application, which can take both time and money to prepare. So having that in place will really help sort of smooth some of that regulatory burden that you're going to have to deal with. The other thing I would note and I would flag is that your data sets are going to undergo regulatory scrutiny. So the selection and validation of those data sets, all of that is going to be subject to Health Canada's review. You want to demonstrate accuracy, the absence of bias, but the one kind of interesting thing is that you need data sets that are going to be representative of the Canadian population. And this in particular, we've seen cause problems for developers who have developed their device, their AI-enabled device, outside of Canada on training data that is not really, representative of the Canadian population. One of the ways some companies are trying to get past this is to work with Canadian clinicians in Canadian facilities with Canadian patients to do sort of, for lack of a better word, a clinical audit where AI responses and output is benchmarked against day-to-day clinical practice. And that's how that data is being generated. And it also provides the opportunity for testing protocols, which need to be robust as well. And the last thing I'll just finish off with is be prepared that once you do get through the application process, you may not get a full and complete license approval. You may get a license with conditions. So Health Canada does have the ability to put terms and conditions on a license. And one of those requirements could be, ongoing testing or ongoing submission of test results or feedback. So just be prepared that you may have to engage quite a bit with the regulator, more so than what I think a lot of vendors are used to with more traditional software, more traditional medical devices.
Thank you, Manpreet. Challenging enough to, I think, get approval of a standard medical device, but that much more so given if AI is being implemented as part of it. It sounds like it's not insurmountable, but it's quite challenging. I think my assumption would be if a company is able to get an approved medical device license for something that's AI enabled, it should be freely, adoptable by healthcare professionals across the country. It's a national approval, so you would hope that it could be freely adopted and used by clinicians within hospitals. But I'm just wondering if colleges, self-regulatory bodies for physicians, nurses, healthcare professionals like colleges of physicians, have they taken a stance on the use of AI in practice? Do they limit, their commentary to approved medical devices? Just wondering, Manpreet, if you have a view on what they're saying about this.
I think similar to Health Canada, a lot of the provincial colleges are also playing catch up, right? Nobody really expected AI to have such an exponential growth over such short a period of time. And so what we're really seeing isn't so much definitive laws that are applicable, but more so policies, lots of policies and guidelines depending on, the province and what your profession is. Each of the different professions has some sort of AI-based guideline. A lot of them do dovetail with one another, but there can be distinctions depending on what your role is as a healthcare provider. Most of them just extend existing professional duties. They focus on accountability, they focus on transparency, and they focus on consent, as Heather discussed this and summarized this nicely. So the core expectation of healthcare providers by the colleges has not really changed. AI will not replace clinical judgment. And at the end of the day, it's going to be the healthcare provider who's going to be accountable for the decisions that were made using that AI tool. And you need to keep in mind that there could be hallucinations, you could inherit biases, systemic biases. So there are a lot of ethical concerns that you need to have. And a lot of that seems to be put on the individual healthcare providers or health organizations to do a proper vetting. Some ministries are stepping up to try and help speed up that process. For example, we talked about AI scribes. The Ministry of Ontario does have a list of approved AI scribe programs and solutions that clinicians can use, and those ones have been vetted to actually meet regulatory and privacy considerations. So we may see an increase in these types of approved lists or lists of approved vendors, but a lot of it does fall on the individuals to make sure that they're staying in the loop, reduce autonomy for AI applications where you can, make sure there's human in the loop protocols, engage in any kind of training and education you need to, so you can actually make sure that the doctors and the nurses and everyone using the AI tool actually knows how to use it, and always prioritize patient interest. Not every tool really needs to be used on a patient just because it's available. It may not be appropriate, especially with respect to certain vulnerable groups or diverse populations. For AI scribes, for example, if someone has a very thick accent, is it really the appropriate tool? So these are the kinds of considerations that are still, the onus is still on the healthcare provider themselves to really make sure that they're using it ethically and transparently.
Thanks, Manpreet. That brings me to a question that I would like to bring Gabriel in on. You mentioned, Manpreet, that ultimately the healthcare professional still remains responsible for their patient, and that makes sense, I think, intuitively. If I'm thinking though that there's a monitor that's being used to monitor someone's heart rate remotely, so the patient's not taking up a bed in the hospital, they've been given a device, they're being remotely monitored, and if the heart rate, let's say, exceeds a certain threshold, there should be an alert that goes to the healthcare professional who's now told, you should be following up with the patient. I'm just thinking, yes, the healthcare professional is ultimately liable for the patient. But I'm also thinking that if there was some kind of a failure in the AI technology, there would be a bit of a fight about liability. Gabriel, from your commercial perspective, how do you see this playing out? How is it resolved? Is it a matter of negotiation between hospitals who, I guess, have the healthcare professionals as independent contractors on site? Is it negotiating with the AI tool provider? How does it play out?
Yeah, I think that's right. I mean, it is negotiation, because if you take a step back, I mean, I think as exciting and as new as AI can be, sometimes there's a bit of a distraction of AI as a concept, right? Because when you look at the contracts, a lot of the issues are the same issues. Who's responsible for what? Who owns what? Who can do what with what data? These are the same issues, particularly as a technology lawyer, right? That we've been dealing with software for a very long time. And so when you're sort of fighting out, well, say the patient, sue someone because they got a bad reading and the doctor made a bad diagnosis. How does this all flow down? Can the patient sue? That all gets negotiated, right? Like, if you want to limit what the patient can actually do, well, you have to flow those down as terms into some sort of agreement with the patient. It's the same way where software vendors traditionally, when they're licensing software to hospitals, they may say, well, here's a set of key terms and conditions which you must flow down to your patients as well, right? Sort of continuing that limitation of liability, those restrictions. It's the same sort of issues, right? And I think what we are seeing is, both on the customer side and on the vendor side, figuring out what that appropriate starting point is, right? I think I've seen customers with ridiculous overkill, right? Like the worst example I saw was they had an AI provision, mandating the vendor to comply with a whole bunch of AI provisions. And then there was an AI schedule, which was multiple pages long. They weren't consistent. They didn't all work together. Someone obviously just went to an AI seminar and took all of the best practices and made a very messy set of terms and conditions. That wasn't appropriate for the relationship. That was overreach from the customer side of things. At the same time, you're also seeing vendors maybe being a bit more dogmatic in what they're asking for, saying, it's our way or the highway, which in other forms of technology agreements, cloud is probably the most recent example, where you've seen things flatten out. You've seen the more sophisticated vendors saying, we can't just say, we're not going to show you where the data is, right? They realize they have to give a bit more in the first instance. We seem to still be in those early days in AI contracts where the vendors are sort of saying, we can't change these things. We're not going to take any liability. The more sophisticated customers are asking for a bit more, saying, you know what, you can't just say these are as is provisions. You're going to, you're offering us a product to do, objective A, you need to take some sort of liability for objective A, right? You can't just blame your algorithm. You can't just say, well, there's hallucinations, it's not our fault. Well, no, you programmed it, right? And so a lot of this is negotiations. I think we're seeing those healthy conversations now. Both sides, there has been a tendency for the past couple of years for both sides to be a bit more dogmatic. I think that is flattening out, and I think that's healthier. And I think you're getting better agreements and faster resolution of some of these issues as both sides of the fence are being more sensitive to the other side's concerns.
Thank you, Gabriel. That strikes me that this sort of works. This approach works if you've got a vendor on the one side and you've got a hospital or a sophisticated organization on the other side. The parties can talk to each other. Hopefully, can be made to reason with one another. I guess what I'm thinking about is some of the apps that are rolled out that are consumer facing or patient facing, and I've looked at some of them myself, just out of personal interest, and it's sort of like looking at a rental car contract. You get this laundry list of terms where the AI app provider says to me as an individual user, we take no responsibility. There's a limit on liability. We're not responsible for anything. So what can you say about that sort of environment where you don't have an intervening learned authority like a hospital or a clinic? It's really between an app provider and a patient. Are those sorts of exclusions and limitations, are they enforceable? Is it just like any other thing you contract for in an app, in an electronic environment?
Yeah, I mean, and that may be the bad news story for the consumer, that often a lot of those provisions are enforceable, that there aren't a lot of restrictions. I mean, there may be some Quebec consumer protection laws may be a bit more stringent, but generally speaking, at least, across the common law provinces, if I have a health product, Fitbit or whatever, and it's being, made available to consumers, that you have a very broad ability to set those terms and conditions. Now, what you do have to keep an eye on is those consumer protection laws, right? There are new laws coming into force in BC, for example, about subscription services, right? Allowing, new restrictions on that. I could see that being a bigger trend. So it's not necessarily AI specific, but the sort of business models you see, which often go along with AI subscription services, again, in the health sector as well, consumer protect, that if you don't comply with those laws, there is class action risk, there is regulatory risk, there is non-enforceability risk. So it may not be AI specific, but as soon as specifically when you're targeting consumers, there are regulatory frameworks, particularly consumer protection, which are similar across the country, but not identical. Some provinces are a bit more aggressive on what you can and can't disclaim. So that's what you have to keep your eye open on. That's what you have to keep your eye on looking at, right? And so there are frameworks you need to work within. But that said, for vendors, there are, in Ontario, for example, if you structure it properly, you make the right disclosures at the right time. You're very transparent about these things. You write the consents about, material changes and things like this. You do have a wide berth to set the terms that you want to have vis-a-vis consumers.
Yeah, and I think just going back to something Manpreet said, trying to distinguish, is this a consumer product, is it a medical device? I'm guessing you have to be pretty careful, because if you start straying into claims that make you a medical device, then despite all the good terms and conditions you've put in your app, you probably took on liability without meaning to. So I think what's being said about the app, about the tool is probably really, really critical here.
Yeah, I agree. And again, because that opens up the other can of worms. If you're saying it's a medical device, it's not a medical device, you're opening up risk of misrepresentation. All the consumer protection statutes have rules against that. And so don't sell what you're doing, falsely, right? Don't over, but again, it's nothing AI specific. Don't overpromise, right? Because the more you overpromise, you're misrepresenting yourself. That opens up, outside of even legal risks, there's goodwill risks, right? You don't want to be the person being complained about on Reddit for, well, I promised all these great outcomes. I promised it's a medical device. Well, it's not. You don't want that sort of goodwill hit. And then you also don't want to have the class action risk and the regulatory risk from a consumer perspective. The more you play in the consumer space, the more you're at risk from public blowback, right? If people feel ripped off, you're going to get complained about, right? And sometimes, and you see this particularly in the startup space as well, right? Because they're so eager to get the products out to launch, to get products out to market. They're not necessarily worrying about the image or the regulatory risk, but that's where the risk actually exists.
Great, thank you. Shifting gears a little bit, but still with you, Gabriel. Just wondering if you are, I guess, whether you're on a hospital side of things or whether you're on the vendor side of things, if there's a project between the two parties where you have, enormous amounts of data that is held by a hospital or a clinic, and that data is going to be used to either, build a tool or to hone or improve a tool, I can imagine that there's a bit of tension there between, ensuring that the data that's provided as an input, that the ownership of that isn't lost and somehow handed over to, an app developer from a hospital, but also the output of whatever is developed. I'm guessing that the provider of the data would like to make sure they're going to get the benefit of that, maybe not outright ownership, but some sort of license right or an obligation or commitment from the tool developer to make it back available to the hospital or clinic. So I'm just wondering, what do you see? You handle negotiations on both sides. Is this an area, this sort of data ownership, output ownership, is that a hot button issue, and how is that dealt with?
Data ownership is always an issue in these sorts of things. I would say not often, at least what I'm seeing, and again, this is anecdotal, right? Not necessarily on the data output, because in the same way, at least the sophisticated providers, if you have a word processing software, they're generally not trying to claim ownership to the document you write in the word processing software, right? And so it's not necessarily in terms of, well, who owns what's being generated at the end, right? They're licensing the tool to be used for a certain perspective. Where you're definitely seeing a lot of the fights about are types of things like Heather mentioned, right? Like, is this, can I use this information in a certain way, right? As soon as it's put in the system, can I train my model on it? Can I use it for another purpose? You'll see a lot of arguments around that. What can the data be used for? What sort of liability is there around the data? So there's definitely conversations around who can do, what with this stuff. But again, it's going to vary from deal to deal. And again, it's often related to broader issues, not just AI, right? Because all the parties are protective of their data. You have the overlay, of privacy laws, who actually is a controller of the data, who's responsible for the data. And again, some of the topics we've mentioned before, right? If you're dealing with foreign vendors, they're not always attuned to some of these issues, right? So if I'm a hospital, I'm going to say, well, I have to flow down certain obligations on you as my vendor, right? From a privacy law perspective, to make sure the data is being managed properly. If you're having someone who's doing business in Canada for the first time, that then becomes its own conversation because, well, we're complying with GDPR. We're doing all these other things that may not always purely mapped to what the obligations are here. And so that's where you tend to see a lot of conversations, I'll say, around the data side of things.
Great. Thank you. Thank you, Gabriel. So it sounds like, ownership of outputs maybe is not sort of not that it's never relevant, but not sort of a critical piece. But that brings me to, I guess, sort of thoughts about ownership and intellectual property rights more generally. And Julien, I'm going to ask you to weigh in now. I guess a company that is investing in developing a tool, or maybe an organization that is giving data towards development of a tool, it presumably will be within the interests of those entities to be able to get intellectual property protection for whatever tool is developed. So I'm wondering if you can comment on, the extent to which our intellectual property regime in Canada embraces AI technologies. Does it function just as it does with other types of technology that's not based on AI? What's your take on the IP protection available under Canadian law?
Thank you, Ingrid. And so, in a nutshell, I think, the IP system in Canada covers AI, but AI is fundamentally changing what the valuable assets in healthcare innovation are. So in traditional life science innovation, I would say the instinct was often to think about patents, and you would think about this first, and sometimes it was just the end of the thought. But with healthcare AI, the value may not sit only or may not sit partially in patentable innovations. There's also the code, there's the model, there's the training, there's the user interface of a wearable, there's data, confidential data behind it. So which means that now the IP analysis has to be a little more layered maybe than what it used to be. So if we start with patents, I would say they're very important, but they're no longer automatically the starting point or the best answer. The question used to be, can we patent the innovation? I think a better question today would be, is this the kind of AI innovation that actually fits a patent strategy? Because in healthcare AI, they work best where the AI is going to be tied to some sort of concrete, technical, tangible implementation. So for example, if the AI is embedded in a medical device or a monitoring system, a diagnostic process, a technical process, patents may still fit well. I think there are three questions that need to be asked when you try to figure out whether patent protection is suitable. The first one is your innovation detectable? So that means if a competitor is actually using your invention, can you tell? Because if the valuable part of the AI is within a black box system and you cannot observe that from the outside, then it may be really difficult for you to tell that someone is using your technology, your invention, and then a patent may be of limited value. The second question I would say would be, is it stable? Which means, will this still be the same invention long enough to justify filing and prosecuting a patent application? Because this is long, like take years to get a patent. And we know that in AI, models, workflow, everything changes very quickly. Last but not least, the third question would be, is this defensible from a patent perspective, which means, is this the kind of innovation that patent law will allow you to protect? And what I mean here is with healthcare AI, what we're really doing is mixing together two fields of patent law that were not completely separate before, but that were maybe a little more separate. You have the life science patent law, and then you have software patent law. And software patent law comes with its own specific legal issues, and patent offices in courts around the world, they are still working through those issues, and they're not fully resolved. But generally speaking, it's clear that you cannot get a patent on what is called an abstract algorithm, like a mathematical model, an abstract ID. This is not something for which you get patent. They want something more tangible and technical. And that matters because with AI now, especially in healthcare and life science, a lot of those innovations are going to be built around prediction, classification, optimizations, and those, they don't always fit necessarily well with what patent laws have traditionally found patentable, and that includes Canada. So for healthcare and life science companies, ultimately this becomes a strategic issue. It means very early on, you have to decide whether patent protection is appropriate or whether other forms of protection should be considered or preferred, either alone or in combination, including trade secrets. And we'll get to that in a minute. The second layer of protection worth mentioning, copyrights. So copyrights, that's the protection you get when you express, an original ID. You write a text, you write lyrics, you take a picture, you can get copyright over this. So it's really the expression of an ID, but not a protection over the ID itself. And it matters a lot in healthcare AI because the AI systems are going to be built from code. There's written documentation around it. There are training materials, and there are data sets which can be curated, arranged, distilled in some particular ways, and all of those can be the subject of copyright protection. So important to take this into account. That being said, as I've mentioned, copyrights, they only protect the expression of the ID. So as an example, if I have a piece of paper with a table with clinical data on it, and you have a copyright on it, I cannot go to the printer and make a copy of that piece of paper. That being said, what I can do is look at the piece of paper, understand what the data means, and then use that to make my own AI model better. Copyright does not prevent me from doing so. So it's a different scope of protection, and generally speaking, it's used more as a supporting layer of protection of the innovation, but not necessarily as the main layer of protection. The third layer of protection is trade secrets. And I think in many ways, this is where healthcare AI becomes most interesting from an IP perspective today. So trade secret, generally, it's valuable information which you keep confidential. So the value comes from the fact that it's not publicly known. And on top of that, you have to take steps to protect it. And many valuable aspects of healthcare innovation, they're never disclosed in patent applications and they're never published. And that can include the model architecture, the weight and the parameters you're going to be using in your model, the data cleaning process, the data validation process, and sometimes even the data set itself can be kept confidential. So all of these can be protected through secrecy. And that would be, for instance, if you come to the conclusion that you cannot get patent protection over those, and they're not necessarily subject to copyright. Also, if a company has spent a very long time, years, assembling a difficult to replicate clinical data set, and then the company is going to build the model, validate the model around that data set, the company may very well never want to disclose this to the public and never want to put this in a patent application. So, of course, trade secrets, they only work as long as they remain secret. And as soon as you lose secrecy, you would lose the trade secret. So something to keep in mind, because even if you have confidentiality agreements in place, once confidentiality is lost, the confidentiality agreement is not going to restore that confidentiality. And so the value of the trade secret will be lost. Last but not least, the one I would like to mention are industrial designs. And sometimes it's a little overlooked, even though I think more and more people are looking into this now. But industrial designs, they cover really how a product looks. So the visual appearance, its shape, its configuration. Is there some kind of ornamentation or pattern over some surfaces of the product? And so it matters, for example, with AI, when the product is embodied in a medical device, a wearable, it could even capture a user interface. So in practice, it can add another form of protection that can be very, very valuable, especially when you have a competitor that can work around the patent, but the competitor has a product that kind of looks and feels very, very similar in the market. And I mention this all the time now to my clients because the process to get a design is similar to patents, but it's significantly faster, significantly cheaper, and again, it can be extremely powerful. So as a summary, I would say AI is really changing, what the protectable assets in healthcare are. Patent obviously remains relevant, but more and more what we see is that we're moving towards a stack of IP protection where you will have different forms of IP assets that will cover different aspects of the technology.
Thank you for that, Julien. That's interesting to think about the different ways that the AI tool itself can be protected. I have heard many projects where AI is actually used to do a lot of data analysis, where AI is in and of itself generating IP, and I'm wondering how thoughts have to change. Where AI is used to generate IP, what should organizations be thinking about in terms of the ownership of that, and how to ensure that they can protect that innovation that's coming out of AI itself?
Certainly, thank you. So what we have discussed so far, it was really what are the IP rights, the IP assets that are applicable and suited to innovation. And why do you want those IP rights? Because presumably you're going to be the owner, so you will have an ownership claim over them. However, as you mentioned, now that R&D is moving towards using AI in various ways in innovating, the act of innovation, we get into a number of ownership issues. And the one I mentioned, mainly is going to be related to patents, but I also talk a little bit about copyrights. So the general rule for patents is that today an AI system alone cannot be an inventor. Why does it matter? Because inventions, patentable inventions, they start with the inventor. So if you want to have some form of ownership claim to it, you have to be able to get that ownership from someone, and that first person, in many cases, unless rights are transferred to a university or the employer, these rights vest with the inventor. And so there's a line of cases that have made their way through courts worldwide related to an AI system called DABUS that was designed to create novel inventions without any direct human input. And the person who created DABUS tried to get patents, on various inventions, putting DABUS as inventor. And in Canada, so far, what we understand is that this is not acceptable, and only a natural person can be deemed an inventor. That being said, this decision, which was issued by the Patent Board of Appeal, which is an administrative tribunal, if you will, is now being appealed before the federal court. So technically, the story is not finished. But generally speaking, the same result has been reached in many other patent systems in Europe, in the United States. So AI is really treated as a tool, but inventorship still turns on human contribution involvement. Does that mean AI-assisted inventions are unpatentable? I don't necessarily think so. What it means is like the patent system is asking the same human-centered question that it has always asked: where is the human inventive contribution? I'm going to give you an example with AI-assisted drug discovery. You have millions of potential candidates that are being put in an AI system. The system is narrowing this to a small number of molecules that are then selected, validated by a team, and then they will proceed through clinical trials until you find a candidate that works. Well, this may still fit within the traditional inventorship analysis, but the bottom line is the thinner the human contribution is, the more vulnerable the inventorship story is going to be. And if you don't have a valid inventor, you're not going to have a patent. So it's a very difficult situation right now because we understand the general rule, but we don't necessarily understand how it's going to be applied in practice. And for sure, it will be applied by courts in the years to come. We don't know yet where they're going to draw the line as to how much human contribution is sufficient. But the only takeaway I have right now is that human contribution, as much as possible, should be documented very, very carefully, which means if you use an AI system, who framed the problem, who created the prompt, who modified the prompt, who selected the output, who refined the output, who validated the output, all of those should be documented very carefully. And at a high level, you have the same issue with copyrights. So when you have an AI-generated output that is copyrightable, it may be unclear at this time if anyone, who would own the copyright in it. So in the US, we have some guidance already. In the US, they have said that an AI-generated material can be protected only where a human has made enough of the creative choices, and just prompting an AI system would not be sufficient to give you essentially ownership over the resulting copyright. But in Canada, this question is still open. So same takeaway, I would say, for copyright generation, as much as possible, document the contribution of the human, even though we still don't know how much contribution is going to be needed in Canada. And so that's really at the beginning of the creation. So the invention is being conceived, the copyright is being created. We see there are already copyright, patent ownership, inventorship issues, but the ownership question goes, beyond that as well. Because in healthcare R&D now, the collaboration are really multi-party, maybe even more than before. So you can have a typical contractual arrangement with a pharma company funding the work, a hospital that contributes clinical data, a university with researchers, a technology company that provides a model or a platform, and there are a lot of distinct assets now. You have a base model, a trained model, you have the output, the refined output, improvements to the IP, the underlying data set, which is confidential in most cases. So they are not the same thing, and they don't necessarily belong to the same party. And here, unfortunately, because of where we are on the law of patents and copyright and IP generally, ownership is going to have to be clearly allocated by contract. And this goes back to some of the things Gabriel was discussing.
Thanks very much, Julien. I'd like to finish off the IP discussion with one final question you can hopefully discuss quickly, Julien, which is, what are the IP risks for a company that's looking to deploy and adopt AI? Are there any critical IP risks they have to be aware of?
Thank you. Yes. So I would say three. The first one is an extension of the conversation we just had, which is the inventorship for patents, authorship for copyright, and ownership, ambiguity we currently have right now. We don't know how much human contribution is going to be needed to make sure you have a valid inventorship or authorship and ownership claim, but this needs to be carefully monitored. The second, I would say, is what we call, in the patent world, clearance or freedom to operate. Because when you adopt AI, you have IP risk on both sides. You have an IP risk on your ownership of the IP you're putting together and you're creating, but you also have risk of infringing third-party rights. And I would say, this is not a new analysis. We always do this, but in healthcare AI, I would say that risk is probably more complex and a little bit amplified because IP rarely sits in one place. You can have patents covering different aspects, and you can have other form of IP rights that are going to be different from patents. So the FTO analysis cannot assume that patents are the only thing you need to search and that there's only one patent to search. It can be way more complex than this. And I would say that the FTO more and more is becoming a process. So FTO sometimes, can be more considered as of a one-time exercise because you know what the product is going to be. And, you clear that product. But in the world of healthcare AI, products evolve a lot. The final software implementation, the workflow, the commercial product may be different from what you originally envisioned. And every time those changes materialize, you need to get clearance.
Thank you.
Sorry.
Thank you. Sorry. Go ahead, Julien.
No, that's okay. Thank you.
So, having listened to all of you comment on your respective areas, no question, this is a disruptive technology. Questions have been raised in all of these areas. To some extent, it sounds like regulators are dealing with it, or at least thinking about it, even if they haven't come up with a solution for dealing with it. What I would like to do is to put to the four of you, maybe Gabe, you could start first. Do you see any developments in the commercial law area that are really going to have an impact on AI tools, contracting for it, developing procurement? What do you see coming, if anything, in terms of development?
I mean, at least at the commercial, I could see on the consumer space more regulatory activity happening, maybe in consumer protection. I mean, again, it may be more ancillary things like, as I mentioned before, more regulation around subscription services and things like this, which we'll touch on it. there's a lot of, there's AI specific laws which have been in draft and which are kicking around, and a lot of talk about this. I don't know. I suspect if that happens, it'll focus more on consumer spaces. In terms of business to business stuff, I think it'll, in terms of actually laws governing this, it'll probably be ancillary laws like privacy, like all the other areas we've been talking about. And I say that just sort of history, and I could be wrong, but I'm basing it just on analogies in the past, right? There's a lot of talk, we have separate laws for cloud. That never really happened. But again, or guidelines, specific regulators, right? So something like, again, not health sector, but OSFI, right? The financial sector, the financial regulator has specific rules around outsourcing. And so those rules may start to have more guidelines dealing with AI. I could see that happening in the health sector as well. So regulators may have more emphasis on, responsible usage of AI, how these tools are used, all the sorts of issues we've been talking about before. And again, they do have the force of law effectively. And I think that's what will kick around. And I think that's where if the regulators do tend to do that, it'll be the same tensions we have between customers and vendors that we've seen on these other issues, where you have vendors who may not appreciate the sophisticated regulatory, rules. Why do I have to disclose this about how my algorithm works or what inputs have been put in? But there may be some regulator which asks for a bit more transparency there. And so I think that may inform some of the negotiations if you do start to have the regulations. In other IT related sectors, they tend to be very subject matter specific. So that's what I suspect may happen. But again, I am spitballing to a certain extent.
Yeah, some just as a gratuitous comment from my perspective, I do a lot of work on clinical trials. And sometimes there's a desire to use an app to collect information from patients who are reporting on symptoms, when are they having tremors, et cetera. And a few times I've seen, the general terms and conditions of the apps that are used to collect this information. It's the general terms and conditions. And so you've got, that the data can be used for this and that, and they can track data across your use of all the apps you have going on your phone. Privacy policies are the general privacy policies where information can be used for this, that, and the other thing. It's not a good fit. And I would hate to see these very useful tools for clinical trials not deployed because of this, just disconnect between the way clinical trials are run and the fact that there's disclosure to patients and very limited use of information and very, very tightly controlled and the terms that are applicable to apps. So I'm hoping for some kind of guidance from maybe Health Canada or other regulators on the use of apps in connection with trials, maybe opening it up a little bit more. But I think there's definitely going to have to be a bit of movement from tech vendors as well to realize, look, in a clinical trial setting, you just can't apply your general terms and conditions. But perhaps if the regulators take a first step of saying something about it, that can be used to inform discussions with vendors, and they'll be able to do some reform here.
Well, and just to add on to that, I think it's always good advice for vendors to sort of think about what you actually are doing, right? Like, to the extent that you can have your terms really mirror, especially when you're dealing with consumers, right? Because consumers don't always understand these things, even if they're enforceable, and they see some terms, I can use this data for anything. And then they start complaining about it, or they don't use the app and they don't work with the clinical trials, right? And so the smarter vendors, I think, are the ones who realize they have to either be a bit more transparent or have, the plain language summary at the start of the terms and conditions, or they don't say you can use all data. They say specifically what data for what purpose, and they craft their terms for the actual use case, right? Because I think it protects you from legal risk, it protects you from publicity risk and all these sorts of things. And I think you're right. Like, the smarter vendors will turn their mind to, let's be smart about doing our terms and conditions, because you're protecting yourselves in a whole bunch of different ways.
Thanks, Gabriel. Maybe I'll put the question on, what future developments do you see? Maybe Heather, can you say something about in the privacy sector? What good things can we expect to try to deal with all of this?
Mm-hmm. I think picking up on what Gabriel said about legislative reform, I think what's definitely on my radar and which should be on your radar as well, are amendments to the federal privacy law. Last week, the government released its national AI strategy, which is an interesting read for those of you who haven't read it yet, but it gave us some hints about where federal privacy law reform is going. And previously, there was discussion about implementing an AI-specific federal law, ADA, along with amendments to PIPEDA, the existing federal privacy law. And that seems like it's no longer the priority given this AI strategy. And instead, the government will focus on sort of picking up the torch again on reforming the PIPEDA regime, specifically to address the privacy rights of children and to strengthen people's control over their personal information. So this will be exciting news for people who have thought all along that we don't need an AI-specific law and we just need to bolster existing laws so that they can appropriately regulate new technologies like AI. And it might be disappointing news to some people who are really hoping that the government would be picking up an AI-specific piece of legislation again. But all to say, I think federal privacy reform is certainly on the horizon. And if anything, the emphasis is sort of on trust and increasing, as I said, people's individuals' ability to control their data. So to the extent that can kind of be taken into consideration for the folks who are developing AI technologies, that will likely be important in future.
Thanks, Heather. It sounds like you'll be writing a lot of bulletins because it sounds like there's a lot happening in your sector.
It's been an exciting week.
Yes, for sure. Manpreet, are you expecting exciting things from Health Canada or any of the regulators that we typically interface with on this area?
My experience with Health Canada has been that they take their time. So the excitement usually has a bit of a gap in between cycles. But, the last time they released any guidance relating to AI was February, I believe, of 2025. And so, it'll be interesting to see more data come out of Health Canada's review process. I'd be really interested to see how many devices that are AI enabled were approved, what their risk class was, just to get a better idea of what's actually being implemented in healthcare settings in Canada, because that'll also help to assess whether or not Health Canada is going to implement any further guidelines, because, on some level, a lot of these guidelines do seem like stopgap measures where they're not really changing the law, but they're providing interpretive guidance on how to address different issues. So they're using the tools that are available to them. It's more, a guidance document is much more flexible, but it'll be interesting to see how those guidance documents change. As we get more and more growth in the AI sector, there's more and more push for adopting it in the AI sector. And it'll be interesting to see how Health Canada responds to changes in, new laws. So interoperability, maybe that will become a component of AI-enabled guidance as well. And ultimately, eventually, even though it's not on anyone's, list of priorities, there probably will be some sort of AI framework introduced in Canada. And it'll be interesting to see how that is going to trickle down and affect the way AI devices are regulated.
Thank you, Manpreet. Lastly, to you, Julien, anything we can expect out of the Canadian Intellectual Property Office or anyone in the IP space in this sector particularly?
Thank you. Well, I think it's pretty clear that the courts will have to weigh in on all of those issues of inventorship and ownership, because nothing is resolved right now. Whether the Canadian Patent Office will weigh in as well, it's more difficult to say. The Patent Office has recently released a new practice note on the patentability of software-based inventions. Which is changing a little bit, their framework and their approach to this particular aspect of the law, which is interesting. But in the meantime, I think what we'll see is, within the companies, more formalization around documentation practices, because documentation for innovation has always been key in the patent world. You need to document who does what. But I think with AI now, we have new issues that will require a new level of documentation, and that will be part of the evolution of the business. The second one would be a renewed importance in trade secrets. What I mean is that a lot of AI, healthcare value sits in things that are pretty difficult to patent. Data sets, model parameters, and so forth. And I think companies will get much more serious about trade secret governance, because designating something confidential and putting it on a server that is protected may not be sufficient anymore. I think companies are starting to think more aggressively what it means to get your information being improperly extracted with scraping, prompt-based extraction, misuse of platform access. We have a new technology, but we have also a new technology that can be used in ways you did not really think of before. So I think, we'll see a shift toward building real technical, contractual, operational controls around how these assets can and should be kept confidential.
Thanks very much. Those were the topics we wanted to cover. We did solicit questions from the audience in advance of this presentation, and some we've answered, but there were a few that I pulled out that I wanted to address to each of you. Maybe Gabriel, I'll put you on the hot seat for the first question. Someone has asked whether there's likely to be compatibility issues between AI tools if deployed within existing clinic or hospital systems. Are there standards that can be brought into play where the compatibility issues disappear, or they're much less, or is this just going to be a matter of when a hospital contracts for the technology, building in, some cost and obligation for the vendor to make the systems talk to each other?
Yeah, I don't think there's any particular standards. I think you're right. It's gonna be make sure you have the rights to do what you need to do in the agreement, right? So say, for example, you need one AI system to talk to another system, and to do that, you need to have the other vendor play around with some code, right? So you need to make sure that there's the right usage rights. You may need to make sure that there's source code available if need be, or something like, if there has to be code integration, have the rights to do what you need to do there. If you need if for bigger projects and there's a lot of different vendors who have to work together to sort out compatibility issues, you other contractual tools like collaboration agreements where you have more formal cooperation between different parties. But even just at a basic level, right? If you're worried about those sort of issues, and again, this can be part of that negotiation, be clear on your requirements, right? Someone mentioned procurement earlier on, right? If you're a hospital procuring an AI solution and you need to make sure that your new vendor works well with your old vendor, put that in your procurement documents, right? Have that in your form of contract, have it in your specs, ask for that. Or if you don't know what you need, ask for your vendors to disclose their specs so you can do your due diligence, all that, right? Make sure there's no surprises, make sure you have the rights to do what you need to do. And I think that's the best advice I can give.
Thank you, Gabriel. Heather, I'm wondering if you're able to answer this question. Someone in the audience has asked whether we think that data sovereignty initiatives are likely to come into play in Canada. Are we moving to an acknowledgement that, look, information has to cross borders if this is going to work and if we're all going to be interconnected? Or is there going to be a move to, we really should be housing the information within Canada, not letting it go across borders?
Mm-hmm. I mean, certainly in the healthcare context, there's always been some heightened sensitivity to transferring health data outside of Canada. And currently there's certainly a renewed focus, not just in the health sector, but generally on the power of foreign governments to be able to access personal information about Canadians, particularly the US government through the Cloud Act, to be able to access personal information about Canadians when it's processed by US companies or their wholly owned subsidiaries. But despite that, I don't think the response would be, sweeping rules that will require data to be stored only in Canada. I think that's just inconsistent with the realities of cloud computing and global business. That said, if you think of data sovereignty as being broader than just where the data is stored and is more so about, who controls it and what laws apply, then I think, yeah, absolutely, that's top of mind for Canadian policymakers, particularly in the context of AI. And I say that largely because of what is written in the national strategy on AI that I mentioned before. One of the 6 pillars in that strategy actually relates to sovereignty. And so it suggests that there will be an increasing focus on Canadian control, not just data residency, but Canadian control of cloud compute and cloud infrastructure that powers AI tools, and also a focus on leveraging Canadian data specifically. I think the strategy even calls data has to be seen as a strategic national asset. So all to say, I think data sovereignty in some form or another is certainly top of mind.
Thank you, Heather. Question for Julien. How is AI changing the way that IP gets managed and practiced by organizations? You've touched, I think, a little bit on it in your earlier remarks, but just wondering if you can comment on that.
Thank you. Yeah, I mean, what I would do is echo the what we discussed earlier with respect to the human intervention and the human contribution. I think it's pretty clear AI is there and it's here to stay. But the best way to manage IP using AI is not to treat AI as a replacement or a substitute for judgment. It's really a tool that improves speed, coverage, decision making. But we ultimately decision makers, human decision makers, still have to make the judgment call. And so I know that they in the question they were mentioning Copilot. So I would classify this one as a general tool, which means it's an AI tool which is not specific for AI for IP use or IP management. But even those tools can be used in a number of ways. I'm going to give you an example in the patent world because that's what I'm most familiar with. But patent drafting and patent portfolio analysis or patent prosecution aid, you can turn an invention disclosure into a set of claims, a disclosure, some figures. It's very, very useful, and you can definitely get up to speed with it very quickly. That being said, it's still not IP specific. And keep in mind that if you're in an institutional setting or within a corporation and using AI tools, very presumably those tools have been vetted for confidentiality and so forth. The data you put in there is not data that can be used to train the model and so forth. But if you start putting invention disclosure in your own ChatGPT or your own Claude account, just be mindful that it can be a really big problem because very likely this data you're putting in there can be used for training, which means that you may very well be, for the IP and the patent world, disclosing all of this information to the public, and this is not a good thing because you can lose rights. So keep that in mind. But beyond general tools, there are also specialized tools, which are tools specifically designed for patent practice, IP practice, generally trademark practice, where you can search for prior art documents and look for documents in ways that typically were not possible. Typically we used to search by keywords. You're looking for information about a technology, you put the best keyword chain you can, and you get results. But now these AI tools can help you look for things, using semantic searches, which are a little bit different. You can also very quickly analyze portfolio and figure out where there are potentially white space in the market, monitor what the competitors are doing. So there's definitely a lot to be done. But again, I will emphasize it, we as decision maker, human decision makers, have to be in the loop and have to make the final decision.
Thank you, Julien. I think we have time for one more, and I'm going to direct it to you, Manpreet. Someone has asked whether we think that Health Canada is going to be able to keep up with technology development as it's regulating devices and new technologies.
I'm hopeful that they will be able to keep up. I think, that they're very cognizant of the fact that this is, if it's not already a big, part of their work, it has potential to become a big part of their work. It's also, interesting to see that regulators in other jurisdictions are moving on this as well. So I suspect that Health Canada will also act in lockstep with those peers. And I do think that they will continue to revise their guidances, issue new guidances as appropriate. So I am optimistic that they'll they'll be able to keep up. And I hope to see that operationally, in license approvals and the more day-to-day work, that there's also, more streamlining and a reduction of regulatory burden there, because I still think we're in early days in terms of figuring out how, the regulator is going to respond to this new emerging technology.
Thank you, Manpreet. That wraps up our presentation. I would like to thank everyone who was in attendance today, our speakers for having very interesting and thought-provoking discussion points. Also want to thank the audience for submitting such great questions. A lot of them we were going to cover, but certainly you made us think about some other things, so that was very useful for us. And I think what we'll leave with is just a realization that we all need to stay tuned at what's happening here and keep abreast of developments as we all navigate this time of disruption, but both as a legal profession, in-house folks, developers. So we'll stay tuned and probably have an update in the near future when we have more to report on. So thank you all very much.